This is Admiral Brian Christine, the Assistant Secretary for Health at the Department of Health and Human Services. Over the past decade, the number of children and adolescents who reject their biological sex has risen dramatically. Some analyses indicate trans-identifying teens nearly doubled from 2022 to 2023. These young people and their families are searching for answers to gender dysphoria. They deserve honesty, compassion, and the strongest evidence for the help that the medical profession can offer. And that is why the United States Department of Health and Human Services worked with 9 academics with professional backgrounds in medicine, bioethics, psychology, and philosophy to conduct the most comprehensive review to date of the standard of care for gender dysphoria in minors. The findings within the 400-page peer-reviewed report are clear. Sex-rejecting procedures such as puberty blockers, cross-sex hormones, and surgeries for children are dangerous. They can cause infertility, a loss of sexual function, reduced bone density, metabolic and cognitive effects, and certainly surgical complications. They can scar kids, both physically and emotionally, for life, and they can do irreversible harm. I implore physicians and parents to read this report and protect children from fraudulent procedures. My message to parents and kids navigating a world mired in confusion and despair is very simple. The prior administration and my predecessor, Rachel Levine, manipulated and betrayed vulnerable families. The Trump administration has the wheel now, and we will never, never abandon you. We are committed to gold standard science, not a political agenda, and we are always guided by radical transparency. Today, we are releasing nearly 200 pages of independent peer reviews that confirm the accuracy and the integrity of our findings. Around the world, countries like the United Kingdom, Sweden, and Finland have already shifted course, emphasizing psychotherapy and mental health support for children confused about their sex, and it is long time that we do the same in the United States. And this is not about politics. It's about science, it's about safety, and it's about trust. Our mission is to ensure every American, and especially every child, receives medical care that is evidence-based, that is ethical, and worthy of the public's confidence. Protecting our children's health and their future is good medicine. And it's also our moral obligation, and in the administration, we take this obligation very, very seriously. At the Department of Health and Human Services, we will continue to be guided by gold standard science, a dedication to radical transparency, and always the truth. That is our commitment to the American people, and it's my promise, my pledge to you as the Assistant Secretary for Health. Blessings upon you, upon your children, and upon our republic. Thank you.
Produced by the U.S. Department of Health and Human Services.